Hi everyone, I'm Kim. I'm going to talk a little bit about informed consent, and first I'm going to talk about what it is. So informed consent is usually a document that's used between the therapist and the client to explain the client's rights, to inform them of what's going to happen during therapy, and really anything that they can expect in the therapeutic process. So Sheila McLean in 2009 was talking about informed consent, and she said that it really helps the autonomy of the client make decisions on their behalf. And she said it's really important because what informed consent does and helps with autonomy is that it doesn't allow any external factors to make decisions on behalf of the client. And I think that's really important to know. Secondly, it also excludes any external factors from getting involved in the client making decisions on their behalf of their wellness and the therapeutic process. So I think that's important too. So I downloaded a form from Cova Coastal Therapy and Mediation, and I compared that with the ACA guidelines and my state standard of practice in Virginia. And they were pretty similar. I mean, I think that the COVID form really did a great job in explaining the process. So for example, in the beginning of the form, COVA really talks about what the ACA really mandates, which is to have the therapist talk about their credentials, their licensures, their education, making sure that it's all up to date, and basically making sure that the client knows who they say they are, that they are allowed and able by the state to practice therapy. And so that's really important. It's important to build trust and that therapeutic alliance. Secondly, the COVA form talked about records. And the state and the ACA really wants therapists to take great records. They want the records to be confidential and in a secure place because of HIPAA laws. And COVA does a great job explaining their process. They also talk about written consent is needed if those records need to be viewed by somebody else or transferred, which is also mandated by the state and ACA. The other things they talk about is the therapeutic process and the techniques and the risks and the benefits that are involved. And this is really important. The ACA and the state really want the clients to know about all of these things. They really want a transparency involved in here. So COVA really takes the time to explain the procedures and the risks, benefits, goals, that there's no guarantees associated with the therapy, and that the therapy is really a shared effort between the therapist and the client. They also talk about the process, like if it's going to be done face-to-face, if it's going to be done on the phone, things like that. They talk about the techniques, the benefits, and the risks associated with those. They also talk about consent. They talk about minor's consent, that they need to get written confirmation and consent from the parent or the guardian to treat a minor, but that the minor will also be informed on the procedures, on everything that we've talked about thus far, that they have consent to, just like an adult. So it's really important that they know what's going on as well. They talk about terminating the relationship. This is important too. The ACA does not want therapists to abandon their clients if the relationship doesn't work out. And COVA does a really nice job of this. They talk about therapeutic sessions after terminating the relationship. They talk about that the relationship is actually voluntary, so either parties can walk away at any time. The difference is the therapists really are to adhere to the ADA ethics, that they can't abandon their clients. And COVA does a really nice job of laying out the specifics of when the therapist may have to terminate the relationship. They also talk about payment and managed care. They talk about how to submit payments, and if they can't, and what happens then, which is important according to the ACA and state guidelines. So overall, COVA did a great job mirroring the ACA guidelines as well as the state standards of practice.